Hi, I'm Grace Pike with 5 Features. Today we're sitting down with Dr. DePalma with Harvey Pediatrics to talk about everything you need to know about getting your flu shot. Make sure to like, share, and comment for a chance to win a $100 spa gift card. Thanks for watching.
Hi everyone, I'm Dr. Jennifer DePalma from Harvey Pediatrics, and I'm here today to talk to you about the flu. So what is the flu? The flu is a really contagious respiratory illness that happens in the fall, winter, and spring every year. It gives you fever, body aches, chills, sore throat, lots of coughing, runny nose, feeling like you've got run over by a truck, basically. Really tired, really fatigued. Patients ask us all the time, how can the flu be prevented? Well, there are several ways to prevent the flu, and the first and most important way to prevent the flu is to get your flu vaccine. The other thing is to stop the spread of germs by staying home if you're sick, keeping your kids home from school if they're sick, making sure that you're washing your hands all the time, making sure that you're not touching your eyes, your nose, your mouth, especially if you've been touching surfaces or been out to the grocery store or things like that. Make sure you wash your hands before you touch your face ever. The other thing is that if you're coughing or sneezing, make sure you do it in your arm or into a tissue and then wash your hands. Another way that you can help prevent the spread of the flu is taking your antiviral medication if your doctor prescribes it. People really do benefit from getting the flu vaccine. It prevents millions of flu-related illnesses, millions of doctor visits every year. It prevents tens of thousands of hospitalizations. And we know from studies that it does reduce a child's risk of dying from the flu. In pregnant women, it reduces their risk of having big problems with the flu, and it can even protect the baby for a couple of months after the baby's born because of antibodies that have built up during pregnancy for moms that have had the flu vaccine. It does reduce the severity of illness in people who do get sick with the flu, meaning you're going to hopefully have an easier time with the flu if you've had a flu vaccine, even if you end up getting the flu. What are some of the complications of the flu? So bacterial infections can happen during or after the flu, and those are things like pneumonia, sinus infections, ear infections. So a whole other set of problems that can make you feel really miserable after the flu is even gone. The other thing is the flu can make any underlying medical condition worsen. So things like asthma, diabetes, those things can get worse, or you can have flare-ups of those diseases because the flu is weakening your system. The other thing is that, unfortunately, a lot of people die every year from the flu, and even healthy people can die from the flu, even if you don't have an underlying medical condition. And that's why we take the flu so seriously. People ask us a lot, who should get the flu vaccine? The fact of the matter is that everybody 6 months and older should get a flu vaccine every year. But in particular, people who have a really high risk of complications from the flu should definitely get their flu vaccine. And so those are babies under 2, older adults, anyone with chronic medical conditions, or if you take care of any people that fit into those categories, then you definitely should also get your flu vaccine. But the bottom line is, you don't want to get the flu yourself either, because even if you're healthy, you can still have a really rough time with the flu. So bottom line, everybody should get their flu vaccine. There are occasionally some people who shouldn't get a flu vaccine, and those are people who have had a serious allergic reaction to the flu vaccine. It's not common, it does happen sometimes, but talk to your doctor if you feel like you've had a serious allergic reaction to the flu vaccine. Just getting some body aches or some fever after the flu vaccine does not mean an allergic reaction. It actually just means that you were activating your immune system, and your immune system was standing up and paying attention. So that is an immune reaction, but not an allergic reaction. People with egg allergies typically ask whether or not they can have a flu vaccine. And studies have shown in recent years that virtually all people with an egg allergy can get the flu vaccine. So just make sure you talk to your doctor. Everyone should get their flu vaccine as soon as it becomes available in the fall. There's really no reason to wait until later in the season to get a flu vaccine. The ideal time to get it is September or October. Get that flu vaccine so that it can build those antibodies well ahead of flu season. And just a reminder that kids under age 9, if it's your very first year of getting a flu vaccine, you need a booster about a month later. A lot of people think that, well, if I get the flu, I'm just going to take antiviral medication. Well, antiviral medications help, but they don't kill a virus in the way that an antibiotic kills a bacteria. Antiviral medications can help reduce the risk of complications from the flu and may make your illness a little shorter or a little less severe, but you're still going to have the flu. They really should, though, be started within the first 48 hours if you're going to take them. They're really only going to be useful in the first 48 hours of the illness. It's really important to get reliable information about the flu and the flu vaccine. So make sure that you talk to your doctor about flu vaccination, what to do if you get the flu. But there are a couple of other resources that you can go to. One is cdc.gov/flu. The other is healthychildren.org, which is the website of the American Academy of Pediatrics. They have really great, really reliable information on there that we trust. So again, I'm Dr. Jennifer DePalma from Harvey Pediatrics talking to you today about the flu. I hope you all have a very healthy flu season and that I don't have to see you in the office. Take care.
Thanks for watching. Don't forget to like, share, and comment for a chance to win that $100 spa gift card. And tune in next month when we're back with Harvey Pediatrics. Thanks.